All right, here's one of our patients. He's a pro baseball player. He's got two Achilles tendons injuries, but we've done our soft tissue work. We've done some rehab with him already. What we're doing is now testing to see if we have a tape job that's going to be effective for him. So classically with this, we'll do a kinesiology strip, which just goes straight up and down. But we want to use one of our advanced methods that we use at Bergen Chiropractic for an Sprt tab, which is a fascial pull that determines whether or not a patient's going to have a greater relief. So as he goes up on his toes, he assesses his pain. Then what we're going to do is we're going to take a skin pull from the outside to the inside of the Achilles, and we're going to have him go back up again. And then we're going to assess, again, the easiest way I like to say, if it was a 10 the first time you did it, what did it drop to? And that was a really big relief. And then we'll do the same thing on the opposite side. And back up again. And this is the more severe of his two, and if it was a 10, what did it drop to? Okay, so we've already seen that the taping is going to be effective. The biggest problem I see with most tape jobs nowadays is people just slap it on because they've learned it, but they don't know it's going to work. When you do pre-testing, you're going to know your tape job is going to be effective before you actually put the tape on. All right, so the first tape job we're going to do with him is just going to be the classic kinesiology strip, which he's had some success with during the season. We're going to just start that at his heel. His foot's already in the dorsiflex position. We're just going to run that tape straight up the calf. Now the second strip, which is the one that's going to give him the greatest amount of pain relief, we're going from the outside of the ankle to the inside. I tend to place the tape right over the malleolus so there's a little bit more room. The big thing here is just make sure you don't create too much tension so that the Achilles, you have some skin to pull from. Now what we're going to do is make an Sprt tab. So this is leukotape. We're just going to fold that into a tab, just like that. We're going to put it to the outside of the Achilles, since we're pulling from outside to inside. And that tab is now going to mimic what our hands did with the skin pull. And you can even see through the tape a little bit that there's a bit of a convolution that was made right in the skin. And now we're going to do the same thing on the opposite side. Okay, on the opposite side, we're doing the same tape job because that's the way he tested. Again, starting from the outside.